Hello everyone. In today's video, we'll study guidelines related to medicine chapter. The topics covered in this video will be end-stage renal disease services and ophthalmology services. So watch till the end. Let us start with the guideline for end-stage renal disease services. So the codes 90951 to 90962 are reported once per month to distinguish age-specific services related to the patient's ESRD performed in an outpatient setting with 3 levels of service based on the number of face-to-face visits. So this is the guideline related to these codes 90951 to 90962, that it is reported once per month to distinguish age-specific services related to patient's ESRD performed in an outpatient setting. Let us check the codes, that is 90951 ESRD related services monthly for patients younger than 2 years of age and counseling of parents with 4 or more face-to-face visits by a physician or other qualified healthcare professional. Then you have the code 90952, which is for 2 to 3 face-to-face visits. Then 1 face-to-face visit. Then you have ESRD for patients 2 to 11 years of age. This is for 2 to 3 face-to-face visit. This is for 1 face-to-face visit. And 90957 is for patients 12 to 19 years of age. This is for 4 or more face-to-face visits. This is for 2 to 3 face-to-face visits. And 90959 is for 1 face-to-face visit. 90960 for patients 20 years of age and older, 4 or more face-to-face visits. 90961 for 2 to 3 face-to-face visits. 90962 with 1 face-to-face visit. Next, we have the guideline for the code range 90963 to 90966. So these codes are reported once per month for a full month of service age-specific services for ESRD service for home dialysis patients. That is for the code range 90963 to 90966. Check the codes. 90963 is for ESRD service home dialysis per full month for patients younger than 2 years of age. Then 90964 for patients 2 to 11 years of age. Then 90965 for patients 12 to 19 years of age home dialysis. Then 90966 for ESRD service home dialysis per full month for patients 20 years of age or older. Then we have the codes 90967 to 90970 are reported to distinguish age-specific services for ESRD service for less than a full month, that is per day. Let us check the codes. So here ESRD related service for dialysis less than full month of service per day. Highlight all these terms for patients younger than 2 years of age. Then 90968 for patients 2 to 11 years of age, 90969 for 2 to 19 years of age, and then you have the code 90970 which is for 20 years of age or older. Now let us solve some questions related to ESRD service. Read the question. A 14-year-old patient underwent 4 daily ESRD services in the outpatient clinic to being hospitalized. A complex assessment was not provided before the patient's hospitalization. How should you report the daily services? So check option A 90957. 90957 is for ESRD related services monthly for patients 12 to 19 years of age, 4 or more face-to-face visits. But in the question they have mentioned underwent 4 daily ESRD services. So we cannot code for 90957 which is for ESRD related services monthly. So we'll eliminate option A. Coming to option B 90965. 90965 is for ESRD related services for home dialysis patients 12 to 19 years of age. It is for home dialysis, but in our question there is ESRD services in the outpatient clinic. So we cannot code for home services. So eliminate option B. In option C they have mentioned 90957 which we already checked in option A, that is for monthly services. We cannot code it for daily service. So we'll eliminate option C. We are left with option D which is the right answer. 90969 multiplied 4 times. 90969 is for ESRD services per day patients 12 to 19 years of age. Here the age of the patient is 14, that is matching, and also they have multiplied it 4 times because the code is for per day, and here 4 daily ESRD services are mentioned. So we have to code 90969 into 4. We have to multiply the code as per the number of days mentioned. Read the question. The patient is a 20-month-old with end-stage renal disease receiving dialysis twice a week awaiting a kidney transplant. The patient's parents receive weekly face-to-face counseling services regarding the patient's care and ESRD status. So here they're asking what is the correct code for monthly patient's dialysis care. Check option A, 90951. 90951 is for ESRD related services monthly for patients younger than 2 years of age, 4 or more face-to-face visits. In option A, 90951 is multiplied 4 times. In option B also they have mentioned 90951. Now check the code 90952. 90952 is for end-stage renal disease services monthly younger than 2 years of age with 2 to 3 face-to-face visits. Check option D, 90954, which is for ESRD service monthly for patients 2 to 11 years of age, 4 face-to-face visits. Now let us check what they have mentioned in the question. The patient is a 20-month-old with ESRD and the patient's parents receive weekly face-to-face counseling services. Now let us try to find the right answer. In the code 90954, the age is 2 to 11 years, but in the question the age mentioned is 20-month-old. So directly eliminate option D. Now we are left with option A, B and C. 90951, 90952. In 90951 they have mentioned 4 or more face-to-face visits and 90952 is for 2 to 3 face-to-face visits. So in this scenario the patient's parents receive weekly face-to-face counseling services. So they're asking what is the correct code for monthly patient's dialysis care. So since they're receiving weekly face-to-face counseling, for 1 month there are 4 weeks. So there will be 4 face-to-face visits. So according to that we'll eliminate option C, 90952, which is for 2 to 3 face-to-face visits. Now we are left with option A and option B. That is, in option A, they have multiplied 90951 4 times. But remember that we should not multiply 90951 because that is for monthly service. So we have to report it only once. So the right answer is option B. I hope you're clear with it. Now let us study ophthalmology services in medicine section. So here they have mentioned the definitions, that is for intermediate ophthalmological services. Then the definition for comprehensive ophthalmologic services and definition for special ophthalmologic services. So go through the definitions once. We have the codes for general ophthalmological services, that is for new patient and established patient. Then codes for special ophthalmological services. Then we have codes for ophthalmoscopy. Then we have codes for other specialized services. Just go through the code range once. Let us solve a question related to ophthalmology services. I am sharing important guidelines and practice questions to help you clear your exam in the first attempt itself. So don't forget to show your support to my channel by liking, sharing and subscribing. A patient completed a diagnostic computerized ophthalmic scan of the retina on both eyes. The physician's interpretation and report included changes to the retina in the right eye from a previous study. The left retina looked stable and with no changes noted. The physician is scheduled for follow-up study in 3 weeks to assess any new changes and treatment as needed. How should the physician report the services? Check option A, 92132. 92132 is for scanning computerized ophthalmic diagnostic imaging, anterior segment with interpretation and report unilateral or bilateral. We have to check the anatomic location while selecting the code. Code 92132 is for scanning computerized ophthalmic diagnostic imaging anterior segment, but in the scenario they have mentioned retina. Retina is located in the posterior segment, so we'll eliminate the code for anterior segment, which is present in option A and B. We are left with option C and option D. The difference is in option D they have mentioned modifier 50. which is for bilateral procedure. In the scenario, the ophthalmic scan of the retina is performed on both the eyes, but the code 92134 already includes unilateral or bilateral, so we should not append modifier 50 separately. Therefore, modifier 50 is not required when reporting. So, we'll eliminate option D. We are left with option C, which is the right answer. That's it for today. In the next video, we'll study some more guidelines related to medicine series. And don't forget to check the playlist CPC Exam Medicine Series for more.